we're very lucky to have Dr. Lawal here, who is working to implement wastewater surveillance at the Houston Health Department. Dr. Lawal is the APHL CDC COVID-19 Associate and Technical Lead for the Wastewater-Based Epidemiological Surveillance Project at the Houston Health Department Laboratory. She specializes in molecular assay development and validation and received a PhD in environmental toxicology from Texas Southern University, a master's in molecular pathology from Texas Tech University, and both a master's and a bachelor's degree in microbiology from the University of Ibadan in Nigeria. Abidat, thank you so much for sharing your time and expertise.
Thank you for having me, Jeff. So from our experience, there are key questions that any lab, any public health lab that is wanting to implement this, which I know is a national need now for monitoring and for prediction of occurrence, to pay attention to these 5 key things that I'm about to discuss, because this will help for successful implementation of a functioning lab and COVID-19 testing in wastewater in this public health lab that is wanting to do this. Now, the first thing is you want to ask yourself, do you have the funds? And if the funds are not currently available, are you going to be getting the fund? What type of fund? And how long will you have this fund for? Because, you know, without the funds, you can't really do much. To set up a lab, you also know that your sample has to be coming from somewhere. For us, our target was based off clinical clusters. So the data from clinical cluster is what we use in Houston Health Department to determine the communities where the wastewater samples will be collected and tested for monitoring purpose. Also, you need to ask yourself, how frequently do you want this sample collection to be done? And you have to project your testing volume, because that will determine the number of personnel that you need to work in the lab and how much space you need and all other logistics that you need to put in place. Now, a key thing is you need to know your methodology or identify the methodology for testing. A lot of labs use different things: ultracentrifugation, use of PEG, polyethylene glycol, centrifugation, and different other methods out there. But for us, we use the membrane filtration through direct adsorption of the virus on membrane filter and then followed by RNA extraction and all that, which I will take you through very shortly. Now, the type of methodology you choose will be based on the resources you have and the expertise of the technical expertise of the people that are in charge of your project. And you also have to think of the equipment you need: freezers, centrifuge, and every other thing, the manifold, and whatever it is that is relevant to the test you want to do. Now, also, when you finish the test, you want to start thinking ahead. What is the procedure that I need to put in place or be aware of when I want to report my data? Because at the end of the day, you don't want to do this hard work and sit on the data, because the data is of public health use and is going to determine how it will be used.